In all of the things that we do to train, to address primary care issues, to address the health of those that are disproportionately affected by health issues, with fibroids being no exception, we are here to lead the creation and advancement of health equity. And for us, that really is imbibed in what CDC says and what we really own as the definition of health equity. And you know that that term has been thrown around very loosely these days, but health equity for us means giving people what they need in the amount that they need it, so that they have all of the facts that can allow them to live their best life and to achieve their most full potential. TX means that the community is engaged from the beginning, that we have interdisciplinary teams. So that means that the teams don't just include researchers. So the White Dress Project as an important collaborator is also an important way that we can get out of the academy and make sure that people who should care and do care are engaged in the conversations. TX also means that research results broaden the evidence base. So you've heard from Dr. Al-Hindi, Dr. Littman, and Dr. Thompson. We want to be able to make sure that the science speaks and is evidence-based in terms of what works and doesn't. Most importantly, you all, the TX model of Morehouse School of Medicine requires that the results are adopted or adapted in communities. That means that what we learn has to change something. It cannot sit in our academic walls. It cannot sit at conferences. While all of those things are important to us getting funding, it must move out to where the people are. And it can't move there unless we come to you and collaborate to learn where you are, what questions you have, so that that trust can be built and solutions can be developed. It takes all of this to move the needle. None of it is less important than the other, but when we bring that together, it represents TX, and that's that exponential movement of research to community transformation.